Goeienaand, good evening, fellow South Africans and citizens of the world. And we keep on talking about Eskom, but there's a huge crisis developing right now in South Africa in the health industry. The public health industry is in crisis. The hospitals are running out of drugs. Yes, even the very important basic antibiotics, they're running out of those drugs. All you need is some kind of a cataclysmic disease ravishing the country, and the health department will just completely collapse in a big ball. But there's a lot more to the story, because we got the complication of the National Health Insurance Scheme, which is kind of like, it's kind of like just escalating the problem, make it even harder to manage. And this has now been borne out by Treasury. Because, of course, you've got to fund something like this, haven't you? But when you've got a country that's in a financial hole, how the heck are you going to fund something like a very expensive NHI, or National Health Insurance Scheme? Shrinking growth and a widening budget deficit is impacting the affordability of national health insurance, according to the medium-term budget policy statement. The policy statement was tabled in Parliament by Finance Minister Thibo Mboweni on Wednesday. Although the minister did not speak in detail on the NHI bill, which is now before Parliament for consideration, he said that Treasury and the Department of Health are engaged in ongoing discussions. NHI is the government's plan to provide universal healthcare access to all South Africans. It is expected to be rolled out by 2026 and is estimated to cost 256 billion rand. Well, I would suggest it's probably 4 or 5 times that. South Africa can't afford it, not even at 256 billion. But anyway, let's see what the policy statement said. The adjusted estimates of national expenditure document, which outlines the status of each government department in relation to the medium-term budget policy statement, noted that the original NHI costs were projected to increase public health spending from 4 to 6% of GDP over 15 years. The policy statement released by the Finance Minister reads, however, the macroeconomic and fiscal outlook, the estimates to roll out NHI that were published in the NHI Green Paper in 2011 and White Paper in 2017 are no longer affordable. The medium-term budget policy statement indicated that domestic growth had been revised down from 1.5% as stated in February 2019 budget to 0.5%. That's a whole percentage drop. Furthermore, the consolidated budget deficit is projected at 5.9% in the current year. Now, let's remember that the tax base is reducing dramatically as people get the heck out of South Africa. And we're talking about people who are the tax base because they're people with money who can afford to get out of South Africa. The document reads, the National Treasury assisted the Department of Health to develop an actuarial model with updated fiscal costs and limited policy reforms to strengthen the current healthcare system. The revised model estimates that rolling out NHI would require an additional 33 billion rand annually from 2025-2026. These amounts are not budget commitments but indicative cost estimates. The Health Department has consistently been the second largest beneficiary of budget allocations after basic education. According to the medium-term budget policy statement, the average nominal growth in spending for health between 2020 and 2021 and 2022 and 2023 is expected to be 7%, which the country cannot afford. So I don't think the NHI is going to happen. But it's probably too late for a lot of people because the guys who are doctors, who are specialists, they don't want a bar of the NHI and they are pouring out of South Africa. There's a huge brain drain happening in South Africa right now because of this crazy NHI. Trade union Solidarity has released a new report on the incoming National Health Insurance Scheme and its impact on the healthcare industry. Nicoline Veldhagen, a research psychologist at the Solidarity Research Institute, said that the report is based on questionnaires sent to healthcare practitioners in the private as well as the public sector across the country. The general feedback shows that healthcare practitioners have huge concerns about the proposed NHI. Veldhagen said, "The findings indicate that there is a distrust towards the government regarding the way they want to implement and manage the NHI. 80% of respondents are negative or sceptical about the NHI. She went on to say, according to the results of this report, the respondents do not believe that the NHI will succeed in improving the healthcare system and service delivery. Only 15% of respondents believe that it would be possible to successfully implement the NHI, and 84.5% are of the view that the implementation of the NHI could destabilize the entire healthcare system in South Africa and could harm the high-quality service already being provided by the private sector." Now, you'll notice that she's talking about the private sector, not the public health system, because that is a complete and utter disgrace. And we'll get to that in a second. Veldhagen added that the report further highlights the enormous risks that the emigration of health practitioners poses to the future of healthcare in South Africa. There are serious concerns about a shortage of healthcare workers, the more so in the view of the fact that 20.8% of the respondents indicated that they had already taken steps to emigrate, and a further 41% would consider emigrating when the NHI is implemented. In an August interview, Dr. Chris Archer, CEO of the South African Private Practitioners Forum, said that his members are extremely concerned and that the bill may drive emigration, as those who want to leave see it as a reason to do so. ProfMed Medical Aid CEO Craig Comrie said that health professionals are already emigrating. Comrie said ProfMed's members are mainly health professionals, of whom 17% leave each year. This rose to 30% in June and July. Alex van der Heever, Wits School of Governance professor, added that he expects medical professionals to emigrate in their hundreds, joining their countrymen in countries like Dubai and Australia. South Africa is also currently facing a doctor and nurse shortage due to lack of funding, says Health Minister Dr. Zweli Mkhize. Responding in a recent parliamentary Q&A session, Mkhize said the primary reason for the shortage is that the public health sector budget has not increased in real terms for the past 10 years. This has impacted the number of staff that can be appointed, he said. Mkhize added that the demand for health services in the country is increasing, while there is no additional funding to address the change, which results primarily from immigration into the country and increasing burden of disease. He said, "The shortage of health professionals is a global phenomenon and is more pronounced in low and middle-income countries, as health workers are more likely to migrate to upper middle-income countries in search of better living and working conditions." And there's another complicating factor which we'll get to now, and that is that the public hospital system is a death trap. Yep. Something like 10 people a day die in public hospitals because of the incompetence of the nursing staff and mistakes by doctors. And here are the stats. You can't fight with figures. A total of 3,832 patients died last year in Gauteng public hospitals alone, as a result of 10,741 serious adverse events, or SAEs, which largely arise from avoidable medical negligence, said the DA on Wednesday. Now, we had that case just yesterday where one of my subscribers, his father, he fell, broke his shoulder, and a week later, in a public hospital, he died. He died in that public hospital. And they hadn't actually fixed his shoulder at that time. You know, it is the public health system, or the public hospitals are just a death trap. You stay out of there. Let me add to the story. The information about the number of deaths in the Gauteng hospitals was disclosed by Gauteng Health MEC Bandile Masuku in a written reply to DA Gauteng Health spokesperson Jack Bloom's questions in the Gauteng Legislator. An SAE is defined as an event that results in unintended harm to the patient by an act of commission or omission rather than by underlying disease or condition of the patient. According to Bloom, hospitals with the most recorded SAEs were Chris Hani Baragwanath Hospital with 1,763, Steve Biko Hospital 893, George Mukari Hospital 766, Charlotte Maxekze Johannesburg Hospital 722, Helen Joseph Hospital 644, Tele Mugarani Hospital 625, Tembisa Hospital 517, Sebokeng Hospital 511, Weskoppies Hospital 504, Kopanong Hospital 415, Berta Gowiksa Hospital 409, Tambo Memorial Hospital 393, Rahima Musa Hospital 385, Kalafong Hospital 345, and Leratong Hospital 323. Now, just one SAE is not acceptable, but you've got over 10,000 in a year just in Gauteng. Bloom said on Wednesday, "I'm most concerned by the 2,307 recorded deaths of newborn babies and 238 maternal deaths. There were also 866 septic cesarean sections and 1,148 cases of hypoxic ischemic encephalopathy." Okay, I'm sorry, guys. That word defeats me. I think it's encephalopathy. There you go. Encephalopathy, which causes brain damage to children deprived of oxygen. Another indication of poor care, according to Bloom, is the 1,052 cases of hospital-acquired pressure sores that are reported as SAEs, as they have direct impact on the patient's average length of stay in the hospital, increased costs of treatment, and may lead to body disfigurement. Bloom said despite the high number of SAEs, only 77 cases were referred for disciplinary action. He said, "These figures are highly disturbing. They highlight severe management problems in public hospitals and lack of consequences for medical mistakes, which leads to court cases and huge payouts that drain the health budget. This is further evidence of public sector incompetence that would doom the proposed National Health Insurance Scheme, which is administratively very complex," Bloom said. Gauteng Health Department spokesperson Kwara Kekana said it was misleading to claim that the deaths were caused by negligence. Kekana said serious adverse events are not necessary medical negligence. Cases of medical negligence have to be proven. It is very careless and irresponsible of the DA to equate medical serious adverse events to medical negligence. Well, I have to agree with the DA. I think they've hit the nail on the head. The public health system is a disgrace. Kekana explained that an allergic reaction to anesthesia is considered a serious adverse event and does not imply negligence at all. Kekana said, "In the last financial year, the Gauteng Department of Health had over 21 million patients that were seen in various facilities across the province, and of these numbers, 0.057% were serious adverse incidents." Well, just one is too many. That should be 0.00%. And he went on to say, in the first quarter, April the 1st to June 30th, 2019 of this current financial year, already 1.6 million patients were seen in Gauteng public health facilities. Serious adverse cases identified in any of the facilities are reported within 24 hours of occurrence, investigated immediately, and then presented to the Facility Patient Safety Incident Committee. The case is then presented at the Mortality and Morbidity Meeting for clinical review depending on the severity of each case. This is done in order to identify gaps in patient care and develop a quality improvement plan. Well, I think he's talking a load of BS, quite honestly. And that's basically where the health system is. It's gone totally pear-shaped. The NHI is unaffordable. There are thousands of deaths just in Gauteng alone due to incompetence of the nursing staff and also doctors. What a terrible place to be working. All right, guys. Sorry. What a terrible place to land up in if you're sick. Please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, stay safe. Bye for now.